Out of all the cancers that plague women, cervical cancer is one of the most common, and yet we don't talk about it enough.
When it comes to the cervical cancer, convincing the lady that this is needed is difficult because she wouldn't be having any symptoms at all.
India makes up about 25% of cervical cancer-related deaths in the world, and every year over 120,000 women in India are diagnosed with cervical cancer.
Cervical cancer is mainly the cancer of the cervix, which is called as the mouth of the uterus. Cervix is the mouth of the uterus. So the cancer of the cells in this region is called as cervical cancer. Cervical cancer is the most important cancer, the most important cause of cancer, the fifth most important cause in the human population, the first most important cause in the Indian women, and the third most important cause of cancer in the entire Asian population. So what are the early signs of cervical cancer? The early signs of cervical cancer would be spotting, bleeding which could be intermittent in between your cycle. There could be a brownish discharge post a sexual intercourse. There could be a brownish discharge on douching. There could be a brownish discharge on internal examination, or heavy menstrual periods, which could be painful, could be one of the causes or one of the symptoms of cervical cancer.
The human papillomavirus, or HPV, has been found to be the main cause of cervical cancer, and the primary transmission is through sexual activity. There are vaccines available against the virus. In India, two forms are available, Cervarix and Gardasil. Doctors advise that the vaccine is given to women before the initiation of sexual activity. Pap smear tests have also been found to be an effective screening tool against cervical cancer.
Dr. Hema Divakar is an obstetrician and gynecologist from Bengaluru who has been largely involved in advocating for the HPV vaccine.
All the women who have crossed the age of 16 to 18 years need the pap smear test. This test is essentially meant to scrape the cells from the cervix, put it on a slide like this, and then you place the slide under the microscope after fixing it with the fixate. You can walk in, except when you're having your menstrual cycle, you can walk into the doctor's chamber anytime, any day, and it will not require any pre-medication, any anesthesia. It's an outpatient procedure and it takes less than about 20 seconds or so. It is very, very crucial for every woman to get the pap smear at a regular frequency of once in 3 years, because the change of the nature of these cells is very, very slow. So if you're normal this year, 3 years later, you have some abnormality, you still have time to act upon that abnormality.
Pap smears are the easiest and most convenient way to detect cervical cancer.
Of late, we have noticed in the last 5 years' time that the annual rise of patients being detected, Indian women being detected with cervical cancer, is more than 1 lakh, and the annual death rate is more than 75,000. This is just the tip of the iceberg, because the national registry from which we collect the data about these onco cases or the cervical cancer cases is only restricted to private sector hospitals. It is restricted to onco centers, certain labs, and maybe the private hospitals. But there is no extension to the rural area, where we find that people are not even informed or exposed to any of these screening tests.
Here is where the Indian Cancer Society steps in, a not-for-profit organization that works to spread awareness and conduct screenings. The Karnataka branch of ICS holds regular screenings free of cost in Bengaluru and rural Karnataka.
If we see the last year's annual report of ours, we have close to 90 camps that we had done last year, which covered around 6,000 individuals, of which around 4,000 were women. So roughly it comes to around 8 camps a month. That is what we are doing, and it can be both in the urban and the rural areas. Somehow I can convince the lady for a breast examination, but when it comes to the cervical cancer, convincing the lady that this is needed is difficult because she wouldn't be having any symptoms at all. That fear, that lack of knowledge, that ignorance is always there when it comes to these breast and cervical cancer in India. So there is a need for lot of cancer awareness in general for us to bring down the incidence of cervical cancer.
Even though the National Technical Advisory Group on Immunization has recommended that the HPV vaccine be part of the public healthcare system, till date it exists only as an optional vaccine for children under the Universal Immunization Schedule. Why did this happen? For one, in 2009, when PATH conducted a study of the vaccine, some of the girls who were part of this study died. Researchers later said that their deaths was not linked to the vaccine and that they died due to a variety of other factors. It did raise fears. Another reason for opposition is that the HPV vaccine does not cover all the strains of the virus. And with the virus constantly evolving, people have asked, how effective is the vaccine then?
There are very few strains that are being covered in this HPV vaccines. It's not all the oncogenic strains that have been covered. Though they say more than 70% of the cancer cervix is because of 16 and 18 strain, the other strains can also be a reason. And in India, we have found that there are multiple strains and not much research has to gone into it as to which strain is there in which particular region. So to advise a single solution for everybody, it becomes difficult.
Another factor that stands in the way is cost effectiveness. A single shot of the vaccine can cost anywhere between Rs 3,000 and Rs 5,000, which automatically puts it out of reach for a large population. And then comes the moral factor. Several right-wing groups have attacked the vaccine, saying that it would encourage promiscuity and would encourage young women to be sexually active, married or not. The Swadeshi Jagran Manch, an RSS affiliate, wrote to Prime Minister Narendra Modi last year, calling the move to introduce this vaccine in the Universal Immunization Schedule an unmitigated disaster. But doctors say that viewing this vaccine only through the lens of sexual activity is wrong.
There is no other cancer in the body which can be combated with a simple vaccine. So just for the lack of information, just because of lack of awareness, just because of false misconceptions, it should not deter you from seeking either more information or actually translating this knowledge into practice. We have 220 million adolescent girls in our country, and each one of them could have these vaccines. The burden of the disease called cancer cervix will really slash to the bottom line, and this investment today will nurture a healthy generation for the future.